Welcome to the HTLL podcast. We are your co-hosts, Tino Muvuti, Technical Advisor for WASH,
and Emily Harada, Technical Advisor for Health and Nutrition.
In our last episode, we delved into the topic of One Health with some invested staff from around the Advent network. Today, we're narrowing our focus onto South America and an exciting technology for psychosocial support, or PSS, that they have been working on. With us is Eric Leichner, the Regional Emergency Manager for the South America Division of the Seventh-day Adventist Church based in Brazil. He's going to walk us through what it's all about. Eric, welcome to our podcast.
Hi, Tino. Hi, Emily. Thank you for having me.
Now, for our listeners that may be unaware, psychosocial support, or PSS, refers to actions or interventions that address both psychological and social needs of people. It's different from mental health in that mental health tends to focus on diagnosable disorders, whereas PSS is more about general psychological and social care that can help prevent those mental health disorders and sometimes even be used to help treat them when they occur. So, Eric, the South America Division is working on a PSS app, if I'm not mistaken. Can you tell us about what this app project the division has been working on developing is, why it was created, what's its purpose, what does it do?
Sure. So we've been trying in the South American division to incorporate and to promote the integration of psychosocial support in all of our emergency responses. Because we feel that there's always a strong need to complement any humanitarian assistance that we provide with emotional and psychosocial support. And we've been trying to promote that with our country offices and develop materials and provide training so that we have volunteers that are able to actually do those kind of interventions. Now, when the pandemic started, we saw a significant increase in the needs of psychosocial support all across the different countries in our region. And we were not able to implement our in-person type of interventions because of social distancing and the risk that it represented to our own volunteers and especially to the affected populations. Some of our projects were able to, move into some other kind of services like implementing psychosocial support hotline services through the phone. But we took this opportunity to rethink or to innovate in ways that we could use technology to make these kind of interventions easier and more accessible for our volunteers and for our beneficiaries. So we started to think on how we could provide video call interventions, because it's very important when you're performing psychosocial support that you use all your senses, that you see the person that is affected, and that you pay attention to the nonverbal communication. And even when you are in person, physical touch can be very important sometimes. And since we were missing that part, on the phone type of interventions, we were also missing that visual contact. And we thought that providing a tool that will help us retain that visual contact between the volunteer or the person providing the psychosocial support intervention and the beneficiary will be crucial. That's why we thought of this app. And also because this same app could allow us to provide practical training to our volunteers in an easy way, in a way that will be easy for them to follow, to understand, and in smaller pieces that they can do throughout the day. And that's how this idea was born. And then we presented it to Advent International as an innovation idea for intervention on the pandemic, and it was approved. So what the app basically does, it's a mobile app for iOS and Android devices that allows any person to become a volunteer, to register on the app, download the app, do a basic training that is very easy to follow and it's very practical. And once the person completes that training, then he or she is able to be a volunteer and provide psychosocial support interventions. That volunteer can select on the app the timings that person will be available to provide that. And that person, when emergency response is activated through the app, will receive calls from beneficiaries or from people in need, and will be able to provide that psychosocial support directly on the same app. At the same time, on the beneficiary side of things, we provide additional resources for those beneficiaries so that they can have additional tools on how to deal with the situation that they're having, and provide additional support before they can actually make a call and receive the attention from a volunteer.
This is really, really neat. It's really exciting to hear about this. I'm curious, the group of people that this app was originally intended for, it was the beneficiaries of an emergency themselves, or was it really for just anyone, whether you're a church staff, address staff, anybody who needs some kind of psychosocial support, it's there for them. Was there a specific group of people you had in mind when this was being thought of or created?
Yes. So when we initially thought of this, we were thinking more on emergency responses, because those are the times when we feel the strongest need for psychosocial support interventions. And initially, we thought, let's make this an app that can support that and provide that service on emergency responses. And one of the learnings that we had once we started socializing and sharing this idea and the app and testing it now, is that people see that as a very valuable tool to actually complement other type of projects, where they need to keep in touch and provide that type of support with other beneficiaries. And those may be projects that are longer term projects, even development projects, where they have a link with specific vulnerable groups, like people that are going through medical treatment, or women that are part of our microfinance projects in Peru, and many others. So part of the adjustments that we are now thinking in terms of the app on a second phase that we're now starting is making it available to those other initiatives as well. And how do we move from just an intervention that is activated as an emergency response will be, and then deactivated after the critical phase of the emergency response is gone, and now having multiple implementations of the same app for different projects within the same country.
Very, very interesting. That sounds really great. Are there any specific already existing resources that this was modeled after? So any apps that already exist similar to this, or other programs that were being used as a model?
So we started our process with promoting psychosocial support in the region by looking at all the different resources that are available from different sources. So the guides from EASC, from WHO, and many other intervention guides on psychosocial support. And we found that that was a bit confusing for country offices that wanted to start from zero and do something about it, because they didn't know which one to follow and how to implement it. So what we said is, let's try to bring all that together. And we had a professional and specialized in trauma here that helped us go over all those guides and resources and compile the main ideas and the main learning from all those resources and come up with a resource that will be an ADRA resource. It wasn't, we were not trying to reinvent the wheel, but actually make it easier for country offices to implement psychosocial support. So based on that, we developed our own guide that was based on all those existing resources, plus the expertise of these psychologists. And we developed a resource for training volunteers in the different country offices. Now, we used that resource when the pandemic started to migrate or to adapt it actually into a remote intervention type of service. Because everything else that was done before the pandemic was always focusing on in-person intervention. So we got that, we adapted that, and tried to use it in a way that it will be conducive to a remote intervention. We've seen some other cases, especially phone services that are available. And we've also seen some web pages where you can actually find some resources or even book some specialized services, but we haven't seen an app or an idea that was the same in core, basically, as what we were developing.
Now that the app has been developed and it's been tested, you've even talked about working with experts and you mentioned plans to adapt it. I'm sure you and the team there have gathered quite a lot of learnings along the way. What are some of the most interesting things that you've discovered? Is the app serving the purpose that it was created for?
That's a good question, Tino. We are all learning so much from this process. We started from an idea that it was innovative, that was different, and we initially were very excited. We're still very excited about it. We think it's a great opportunity and provides a great resource, but we're learning so much in the process. And one of the things that we learned that I mentioned before is that this could actually be used for other purposes other than just emergency response. And we never thought that it could integrate so well with existing projects that need to create that link and that communication with beneficiaries. So those are some of the discoveries that we're having now. We're discovering also that the process of adapting and creating all that training and content and making it available and easy for volunteers to be trained was challenging, even though we had resources that were very practical. Making them available to a volunteer on a mobile phone that can learn it on small pieces of time, 10, 15 minutes, and still at the end feel that he or she has the confidence to actually receive a call and do an intervention, and that person doesn't need to have all the answers, but has to know how to facilitate the process so the person can express what he or she is feeling and help that person walk through the process. That can be very rewarding as well. We're learning that volunteers want to be part of those processes. They want to take those responsibilities. They are willing to do that. And they want to feel that they are capable of providing practical solutions to people that are suffering, not just creating kits or assembling kits to be distributed, but they want to be in touch with the people that are affected. They want to be part of that solution. So I think in a way we are making so many discoveries and learning, and this is only pushing us or moving us into new opportunities, which is very exciting, which is great for us. I feel that in a way this is a tool that it's opening up a lot of potential for us to tap on a huge resource that ADRA has worldwide, that is volunteers. We have so many of them. They want to be part of that, but many times we were not able to find ways to make room for that. And this tool, this psychosocial support app, is actually completely run by volunteers. We are, of course, developing it, but once it's complete, we rely 100% on them. So this is new for ADRA. So it's exciting. It's great. We are learning so much, and I know that we will be learning much more as we continue to roll out the app. We're doing it in a way that is controlled, so that we learn and we capture that learning, and that we improve it in a way that whenever we implement it in other places, we feel safe and we feel that we're doing the right thing, but we will never stop learning.
That is really amazing. As I listen to you talking about the amazing work that you've done and the very real impact that the app is making, I'm really interested to find out from you, Eric, what you envision would be the long-term goal for this project. Given all the resources that you need, where do you see this going? How big do you imagine that this could be?
I would like to see this become somehow a trademark intervention of ADRA, that we get to be known by the quality of our psychosocial support interventions. And I think ADRA is well known by the dedication and the effort and that ADRA staff puts to everything that we do across the world. And I think we can see the same dedication and commitment and effort from our volunteers. And if we tap into that resource, I think these kind of interventions, being through the app or through any other way, can provide or can be a signature intervention, as something that is characteristic of ADRA. ADRA is in touch with the people on the ground, providing real support that they need, but especially that ADRA is a touch on their shoulders, that there's always the in-person type of relationship with the person that is being through tough times, and that is ADRA keeps that personal touch. And that's why somehow we selected the name. The name of the app is ADRA Touch, because even though it's a virtual tool, it's an electronic tool, we don't want to miss that touch that ADRA has, that we always had when we work with the communities. And no matter if we're doing it now virtually or remotely, we want to keep that personal touch with our beneficiaries. And I think that that's probably what I would like to envision or see in the future from this intervention or this specific project.
Eric, this is so exciting, and it sounds so amazing and really, really useful. And I love the vision that you've expressed with us here. Just a follow-up question: what's the rollout plan for unfolding this within the ADRA network with other country offices?
Yes, so we're going step by step, since this is something that we're learning as we're doing, what we're doing now is doing implementations of the app that are somehow limited and controlled. So we're trying to implement it in a real case scenario. Could be an existing project that has this kind of intervention and reaches to a given number of beneficiaries, and then implement the app in the context of that existing project and see how it performs and make any adjustments that are needed, because we need to also learn how to actually implement the app in those communities. It's not just developing the app and then it's ready to roll, but it's actually how do we, ADRA, learn how to deploy the app in a community and then close that deployment when it's finished. So all that process is a learning process. And we are eager to, continue that. And once we have done that in several places, then feel that we have enough so that anyone can actually do that in any place in the network. And we are working in this second phase on a web portal that will actually allow us to any country office to implement the app on them by themselves. So they will set it up and they will do everything, and we will kind of document the whole process. So it's easier for any new office that wants to jump into the app and start using it to actually know how to do it step by step. So we're trying to follow that process now. We're trying to do those implementations, control the implementations, learn from it, document it, so that that can be later on available to the network in general. But if any country office is interested in knowing more about it and or being part of this progressive rollout of the app, they can get in touch with us. We're happy to share more information or make them part of this rollout and construct this process together with any other office that may be interested in.
It's been so great listening to you talk about what sounds like a really great initiative. We could go on forever, but we're going to give you the last word as we wrap up this episode. Is there anything, Eric, is there anything else that you would like to share with our listeners to wrap up?
I would like to, first of all, thank everyone that is listening for taking the time to actually listen to this podcast and get to know more about this app. I think that we need, and we have seen a lot of support from the network on this project. That is a different one, that is new. And if anyone believes in this project and sees potential in this tool and would like to be part of it, please get involved, get in touch. We would love to tell you more about it. And we're eager to see that being implemented across the network. I think this is what we're doing is just a tool. It's not going to do anything by its own. It's something that we as ADRA offices, as staff, we will need to use, we will need to believe in and commit to and implement in our offices to actually see an impact. So I would like to, challenge each and every one of you that is listening. If you think that this is a good idea, to get in touch and also to be part of it so that we can bring it to a reality and make it, as I mentioned before, something that we as ADRA can be happy and we can feel that is somehow a trademark or something that identifies ADRA in the way that we work, in the way that we do our job.
What an awesome way to wrap up our conversation here today. If you would like to learn more about psychosocial support, are interested in getting in touch with the South America division for more information on their app, or would just like to learn about other topics regarding health, nutrition, and WASH, feel free to contact the Health Technical Learning Lab at healthtll@adra.org. That's healthtll@adra.org. To listen to other episodes of the HTLL podcast, please find us and subscribe to us on Apple Podcasts, Google Podcasts, or Spotify. Thanks for listening, and join us next time for another episode of the HTLL podcast.